My name is Barb Calhoun, and I am a nurse practitioner and outreach coordinator for the Boler Parseghian Center for Rare and Neglected Diseases. The focus of my job is to support rare disease patient families that are enrolled in research studies. We support patients with rare diseases initially by providing them with resources for their particular disease. That would include centers of excellence, experts in the field, current research that's occurring, and also patient service organizations or other support groups that can help them get involved with other patients with the same or similar diseases. I co-teach a fall and spring course with Dr. Kasturi Haldar that is in topics in rare and neglected diseases, and we engage upper-level undergraduate students with patients that have rare diseases.
My name is Lucy Lee. I've been working with Mrs. Calhoun for about 2 semesters. I had her in class spring of 2018, and we've been doing research work together over the summer and the last fall semester. We've been working on a better understanding of the natural history of neurofibromatosis type 1, or NF1 for short. And this is a rare genetic disease that causes tumors to form along the brain, spinal cord, and nerves. While working with Mrs. Calhoun, I've had the chance to meet up with patient families, and interacting with them has helped me really connect with them and made my research more personal and rewarding in that way. We've also helped one of these patient families form an NF resource group in the South Bend area, and we continue to support and fund them any way we can. So Mrs. Calhoun is so fun and patient with me. She helps me get all the resources I need, whether that be connecting me to various physicians, helping me find references for my manuscript, or explaining medical terms and procedures to me. She really wants my research experience to be a growing experience for me, and she does everything in her power to make it enjoyable for me, and so that I feel that my work is something I can be proud of.
I'm Gabriella Doherty, and I've been working with Ms. Calhoun for 4 semesters and 2 summers. Ms. Calhoun and I work on developing natural histories for rare diseases. This involves reading medical records and creating summaries of them. This is helpful for patients because they can have a quick look at their medical history and present this to doctors so they can have any pertinent information from the history that isn't common, especially because it's a rare disease. Ms. Calhoun and I are currently working on publishing a case report in the American Journal of Case Reports, and this is on our recent project with Princeton-Goldberg syndrome. Mrs. Calhoun's medical experience has been extremely helpful in our research. She always knows what medical terms mean, and she can always help me read doctors' handwritings, and she's explained countless procedures to me. She also always cares about her students, and she's always fun to work with.
In addition to that, we provide events such as Rare Disease Day or patient service support groups where we bring patient service organizations together with patients in our community, and they can discuss their needs, and we try to evaluate how we can help them with that. As far as the Rare Disease Day goes, we partner our students that are in our class with patient families, and together they collaborate on their disease. The students learn particular symptoms and diagnosis, treatment, and interventions that occur with that particular rare disease, and the patient follows up by their personal experiences and story that involves that rare disease. We partner students with the patient families to create NORD summaries for their particular rare disease. NORD is the National Organization of Rare Disorders, and they have been gracious to allow us to have students become editorial interns on rare disease reports that need to be updated. And these students actually get with patients that have the disease and update the summaries so that they can be the most current information for patients to have. It's a wonderful program, and it allows undergraduate students to publish their work with their name on it. As the liaison to the research, I hope that I can get as many patients involved in our research programs as possible. I really enjoy meeting these patients and giving them not only a voice, but a hope that there's people out there that are working for them and doing all that we can for their particular disease. I'm really excited to be a part of a rare disease community that is involved in research programs here at Notre Dame. I'm also looking forward to seeing the results of the research and how it impacts patient families in the long haul. When people ask me what I do for a living, I say that I work with rare disease patients in research. And it is so exciting because I get to find ways to make a difference in the lives of these rare disease patients that have very little to go on. My hope is to watch how the research grows at the university and helps these patients. And overall, I would love to have our center be the utmost place to come for patient advocacy and rare disease research.